Picture this for a moment. It's early morning, not quite sunrise yet. The room is quiet, but something feels off. You wake up before your alarm, not because of noise or pain, but because your mouth feels completely dry. I'm talking about that thick, sticky feeling, like your tongue doesn't want to move, like your lips are slightly cracked. And maybe you've had this thought, why does this keep happening? Most people brush it off. They assume it's normal. They assume it's age. But what if I told you? This small, annoying symptom is often your body trying to send you a message most people ignore for years, and by the time they understand it, the problem has been there too long. I'm Dr. Adrienne Cole, and for over 2 decades, I've worked with patients who ignored these early signals. The body rarely shouts first. It whispers. Dry mouth is one of those whispers. Most people think saliva is just saliva, but it's not. It's a protective system. It protects your teeth, balances bacteria, and keeps your tissues healthy. It's a built-in defense shield. So when that system shuts down overnight, that's not random. That's a disruption. Dry mouth is almost never the root problem. It's the signal, the outcome of something else. Let's start with the one that surprises people the most, medications, the number one cause. There are hundreds of medications that reduce saliva production, and almost nobody connects the dots. When taking multiple medications, the effect doesn't just add up, it multiplies. I had a patient, mid-60s, with severe dry mouth. We found 4 different items contributing to it. Now cause number 2, nighttime breathing issues, specifically sleep apnea. While you sleep, your airway partially collapses. Your body struggles, so you breathe through your mouth. That airflow dries out your mouth continuously. By morning, there's almost nothing left. Dry mouth is more than just a surface issue. Today, we're looking at the hidden messages your body is sending. First, sleep apnea. It's linked to heart strain and memory issues. If you wake up dry, your body might be struggling for oxygen. Second, blood sugar. Dry mouth is an early sign of rising levels as your body pulls fluid from your tissues. Third, hydration. As we age, we can lose our thirst signal, meaning you could be dehydrated without even knowing it. Fourth, common medications. And fifth, immune changes. Persistent dryness always deserves a professional checkup. Don't ignore the signal. Stay tuned for part 2, where we'll build your personalized action plan. Welcome to part 2. Now that we understand the signals, it's time for a clear, simple action plan to take control of your health. Step 1, document the dryness. Keep a simple log for 3 days. Is it worse in the morning? Does it happen after specific meals or medications? Step 2, practice intentional hydration. Don't wait for thirst. Set a reminder to take small sips consistently throughout the day to support your tissues. Step 3, schedule a checkup. Bring your 3-day log and mention any other symptoms like fatigue or dry eyes. This data helps your doctor find the root cause. By responding to the signal, you're not just treating a symptom, you're protecting your long-term wellness. Take that first step today. Your body will thank you. Welcome to part 3. You've tracked your symptoms and scheduled your checkup. Now, let's make sure that visit gives you the real answers you need. Present your 3-day log immediately. It's the most valuable tool you have. It shows your doctor patterns, like if dryness hits right after a meal or a specific pill. Ask 2 key questions. First, can we review my medications for dry mouth side effects? And second, based on my log, do we need to screen for blood sugar or immune issues? This turns a vague complaint into a clinical investigation. You're giving your doctor the evidence they need to help you effectively. You deserve to feel your best at every age. Respond to the signal, take the action, and get the clarity you deserve. Thanks for watching. So now you're not just hearing that dry mouth is a symptom. You understand that it can come from multiple directions. And that's exactly why guessing doesn't work. What works is clarity. Because once you identify the real cause behind your dryness, everything becomes simpler, more focused, and far more effective. So let's walk through what you can actually do from this point forward. Not complicated steps, not overwhelming changes. Just clear, practical actions that help you connect the dots in your own body. The first step is awareness of what you're putting into your system every day, and I don't just mean food. I mean everything. Medications, supplements, occasional tablets, even things you don't think about twice. Because this is where many people miss the biggest clue. They assume their prescriptions are working independently, but your body doesn't experience them that way. It experiences everything together, layered, interacting, sometimes amplifying each other in ways that aren't obvious until you step back and look at the full picture. So take a moment, even today, and write it all down. Morning pills, evening pills, vitamins, pain relievers, sleep aids. Anything you take regularly or occasionally, and then bring that list to a pharmacist or your doctor and ask a very specific question. Is anything here affecting my saliva production? Not a general question, a targeted one. Because when you ask clearly, you get clearer answers. And sometimes the solution isn't removing anything, it's adjusting timing, spacing doses differently, or replacing one item with a better alternative. Small changes, big impact. Now, the second step is something most people resist at first, but once they try it, they realize how powerful it is. Tracking your mornings, not in a complicated way, just simple observations. When you wake up, ask yourself, was your mouth dry? Did you feel rested? Was your mouth open? Did you have a headache? Write it down. Just a few words each morning, because patterns reveal themselves over time. After a week, you might start to notice something. Maybe your worst dryness happens on nights when you slept poorly. Maybe it lines up with certain medications. Maybe it's worse when you eat late. This is how you move from guessing to understanding. Now let's talk about sleep. Because if your dryness is connected to nighttime breathing, ignoring it won't make it go away. It will just continue quietly. If you suspect your breathing isn't normal at night, don't brush it aside. This isn't about overreacting. It's about being informed. Sleep studies today are far simpler than people expect. In many cases, it's just a small device you use at home. No hospital stay, no complicated setup. And the insight it gives can be life-changing, because if your sleep improves, everything improves. Energy, focus, heart health, and yes, even that dryness you wake up with. Now let's come back to something that seems simple, but is often done incorrectly: hydration. This is where I want you to shift your thinking slightly. Instead of asking, did I drink enough water today? Ask, did I drink consistently? Because your body doesn't just need water. It needs access to it throughout the day. Large amounts at once don't fix the problem. They pass through. What your body needs is steady support. Small amounts spread out morning, midday, afternoon, evening. And here is something important that I want to share with you. If most of your fluids come from tea, coffee, or sugary drinks, your body isn't getting the same benefit. In fact, it may be losing more fluid than it's gaining. So try this. Start your day with water before anything else. Keep a bottle nearby during the day and sip. Don't wait. That alone can change how your body feels within days. Now let's talk about immediate relief. Because while you're figuring out the cause, you still want to feel better. And there are simple ways to support your mouth overnight. Using moisture-supporting rinses or gels before bed can help maintain hydration in your mouth while you sleep. But here's the key detail many people miss. Avoid anything with alcohol, because alcohol dries your oral tissues even more than you would expect. So while it may feel fresh for a moment, it actually makes the problem worse long-term. Look for gentle, moisturizing options instead, ones designed specifically for dry mouth. They don't just relieve symptoms. They help protect your teeth and gums as well, because dry mouth doesn't just feel uncomfortable. Over time, it changes the environment in your mouth. It allows bacteria to grow more easily. It increases the risk of cavities, irritation, and infections. So, supporting your mouth isn't just about comfort, it's about protection. Now, there's one more thing I want to make very clear, because this is where people sometimes make a mistake. They start improving things and they feel better, and then they assume the issue is solved. But improvement doesn't always mean resolution. It means that you are making real progress. So if your dry mouth has been consistent for weeks or months, or if it's getting worse, or if it's combined with other symptoms like difficulty swallowing, unusual pain, or unexplained fatigue, that's not something to manage alone. That's something to bring to a professional. Because the goal here isn't just relief, it's understanding. And once you understand what's happening in your body, you stop reacting randomly. You finally start responding to your body intelligently. Now take a step back and think about everything we covered. One small symptom can lead to 5 possible root causes, and a clear path to start figuring out which one applies to you. That's how real health works, not through guesswork, not through quick fixes, but through awareness, consistency, and small intentional actions. So tomorrow morning, when you wake up, don't just notice the dryness. Ask yourself a better question. What is my body trying to tell me today? Because that question changes everything. If this helped you understand something you hadn't thought about before, stay connected. Because the next topic we're covering might surprise you even more. There's a very common nighttime habit that seems harmless, but quietly disrupts your body in ways most people never realize. Until it's too late, take care of yourself. Pay attention to the signals. And remember this, your body is always communicating. The only difference is, now, you're finally listening.